All right, everyone. So, did you know that black people are about twice as likely to develop multiple myeloma as compared to white people? Delve into the forefront of multiple myeloma understanding, from emerging treatments to holistic patient care, in this enlightening session with Janssen Oncology Director of Diversity, Equity, and Inclusion and Clinical Trials, Lisa Lewis. Is she around? All right, there she is. Let's give Lisa a round of applause. Vice President of R&D Portfolio Management for Janssen, Stacy Hargraves. Stacy? Okay. Senior Medical Director in Oncology Clinical Development at Janssen Research and Development, Dr. Robin M. Dennis. Dr. Dennis. And Jennifer Orozco, a medical science liaison with the multiple myeloma team at Janssen here in the New York City region. Let's give them a round of applause one more time. All righty. Take it away.
Identify, all of that. How's everybody doing? Good? I have to say, I am full. I've been here. Some colleagues of mine have been here since 8 this morning, and we are energized by you all. So thank you for being here today. I am Lisa Lewis, Director for DEI, Diversity, Equity, and Inclusion in Clinical Trials at Janssen Oncology, where we want to make sure that everyone knows about research as an option. I am honored to be joined by my colleagues today, Dr. Robin Dennis, Senior Medical Director at Janssen Oncology. She covers multiple myeloma and other disease areas. Jennifer Orozco, PharmD, Board Certified Oncology Pharmacist, who covers New York City, working in the multiple myeloma and amyloidosis space. As was said earlier, those are two diseases that affect black communities disproportionately. And last but certainly not least, Stacy Hargraves, MBA, our Vice President of Portfolio Delivery Operations, and the person who established the team at our company that is focused on making sure that everyone knows that research includes them. I'm going to click through. Oh, my disclaimer, as one of the panelists said earlier, this is not medical advice. This is for information purposes only. All of the things, please consult with your physician, your medical provider if you have any questions, but we're here to share some information because knowledge is power. Still trying to click. Can I click? All right. So we're going to go through a couple of questions today. We're going to cover what is multiple myeloma. Dr. Dennis is going to cover that. She's also going to touch on some of the treatments that are out there for multiple myeloma. And then Jenny Orozco is going to talk about some of the disparities that we know exist in black and brown communities specifically for this disease. And then she's going to talk about why access to clinical research is important for multiple myeloma as a disease space in general. And then Stacy Hargraves is going to round it out and just tie it into why research is important for all different types of diseases. If you visited our Research Includes Me table today, you know that cardiovascular disease, cancer, skin diseases, there are all types of diseases where treatments are brought to the market. We want to make sure that we won't know if it works for everyone if everyone's not included in the research. So that's our messaging for today. So Dr. Dennis, kick it off for us. What is multiple myeloma?
Thank you, Lisa, and thank you for having me. It's a pleasure to be here with all of you today. Real quick, let me just see a show of hands. How many people in this room have actually heard of multiple myeloma or have had a family member or friend affected with it? Okay, so good. It's quite a good kind of half and half. So for those of you who know a little bit about it already, this will be a review. For those of you who don't know about it, I'm going to try to give you some basics for what to look for and maybe some other things that might help you understand a little bit better. So multiple myeloma is a rare blood cancer. It affects the white blood cells in your body, called plasma cells, okay? Plasma cells, when they're working well, when they do what they're supposed to do, they produce antibodies. And those antibodies are what in our body fights off infections. But sometimes those plasma cells can be changed, sometimes with genetic defects, and they actually start to function abnormally. Those plasma cells then end up growing out of control in your body, and then they affect the function of all the other cells in your body, including other organs in your body as well. So there's a picture here kind of showing you your bones, and you can see the bone, and the inner red part of the bone is called your bone marrow. The bone marrow is the inner part of the bones that actually makes all of your blood cells. So your red blood cells, your white blood cells that fight infection, and your platelets. Those platelets help you stop from bleeding when you get cut. So inside the bone marrow, the plasma cells are made, and those are those purple cells that you see on the screen. On the top of the screen, you can see those are normal plasma cells. Those cells are producing what we call polyclonal antibodies. Those antibodies are all different functions. They do all types of things in our body, fight infections, secrete proteins, all kinds of things. The bottom picture shows multiple myeloma plasma cells when they become genetically deranged or work abnormal. You can see the difference in the shapes and the sizes of the cells. They are bigger, they're kind of blobbier, and they're making all of these uncontrolled antibodies. But unfortunately, the antibodies those cells are making actually do not function appropriately. So even though it's making them, they're not actually working to fight off any infection, and they're actually harming your body instead. So sometimes we can do a bone marrow test, and that's looking at that middle part of your bone marrow. You can see under the microscope what those cells look like. The top picture is a picture of a normal bone marrow, where you can see all the cells look nice and round, and there's a lot of space in between the cells themselves. The bottom picture is a multiple myeloma patient's bone marrow, where the cells are much more bigger, clumpier, and there's not a lot of space in there because all those abnormal cells are crowding out the normal cells in your body. And that's what we don't want to see. So now that you have an image in your brain of what multiple myeloma is, I want to talk to you a little bit about some risk factors. So who is at risk for developing multiple myeloma? So age is actually definitely a factor. Multiple myeloma, the risk increases as you do get older. Most people are closer to the age of 65 or older, and actually less than 1% of people who get multiple myeloma are less than the age of 35. So it does seem to be something that is more prevalent as an older age. Your sex does, so men or people who are assigned to male at birth are more common to get multiple myeloma than females or people assigned to female at birth. Race, I think you already heard someone say that before we came up. Black Americans are 2 times more likely to develop multiple myeloma in their lifetime than white Americans. That's why it's so important that you understand and know what this disease is. Family history does play a little bit of a role. I saw some people raise their hands that they may have had a family member affected. It does not mean that you will get multiple myeloma necessarily, but it is important to know that they had it so that this way if something does come up, you can bring it up to your doctor. But most of the cases, there is no family history. And so it is important to understand what you're looking for so that you know what to look out for and you know what to tell your doctor about how you're feeling. Obesity or being overweight can play a role. And also having other plasma cell disorders. So there are other disorders that are related to multiple myeloma that you may have heard of. One is called MGUS, M-G-U-S, and that stands for monoclonal gammopathy of undetermined significance. That's kind of a very funny disease state because some people who develop that, it actually goes away without treatment, and some people don't even know they have it. We don't really understand why people with MGUS actually develop myeloma and why some people don't. So that is something I think a lot of research will have to go into. There's a picture on the screen that's actually showing you the kind of the general flow between a normal, maturing, normal plasma cell in the green. And then you can see the MGUS cell has like some newer genetic abnormalities, like a green cell and then the blue cell and the yellow cell. Those cells are abnormal. But they may not actually cause disease and they may actually go away. But sometimes it doesn't go away. And then you end up with something called SMM, sometimes, not always. That stands for smoldering multiple myeloma, which is actually something that I work on at Janssen. That is when there's even more genetic defects in the cells, and then the cells get more and more abnormal. And then eventually, some patients will develop full multiple myeloma, which is at the very end of that picture. That's when you see all those really angry red cells. Those are the real abnormal cells that are crowding out your bone marrow, and those are the ones that are going to require the most treatment. So this is just so you have a picture moving forward of what multiple myeloma is and sort of how the natural history might progress in a patient. So in terms of symptoms, some people may not actually have any symptoms at all. And then some people might have symptoms. Things to look out for would be bone pain, problems with your kidney function, maybe elevated calcium levels are sometimes seen. Some people have described pins and needles, kind of like a tingling sensation in their fingers and toes. Those are sometimes things to look out for. But oftentimes, it's actually just picked up on a routine blood test. So some of the blood tests that you can do, and I think that your doctors will kind of do routinely anyway to check for this, are things like a blood count, so looking at your red blood cells, your white blood cells, just making sure the counts of those are normal. Looking at your kidney function, make sure that's functioning normally, looking at your calcium levels, all of those things. If any abnormalities are there, it could potentially pick up maybe an early stage of something like multiple myeloma. There are urine and blood tests that can be done, and those can look at proteins that are specific to multiple myeloma. And also, we can check your antibodies. We can also do bone imaging, because you can see these cells are in the bones. So they can affect the way the bones look on a CAT scan or on an MRI or a bone scan. So sometimes a doctor may actually suggest that. And then the last thing would be a bone marrow biopsy, which is actually taking a piece of the bone inside to look at those cells and to see if there are any abnormal ones. So in terms of treatments, there are a lot of different treatments out there right now. I think most of you guys are very familiar with chemotherapy that kind of kills all the cells in the bone marrow, and then hopefully new cells that are not abnormal will actually grow. There are things like steroids, which you may have actually received for other reasons, but they can be used to treat multiple myeloma as well. They would not be the only therapy for myeloma. They're usually combined with other treatments, but they are used in combination with other drugs. The last thing that some people think of is a bone marrow transplant. That's kind of more of an extreme thing. That's when we take healthy bone marrow from your body and reinfuse it back into your body. So that this way, once we get rid of the bad cells, we put back new good cells. That's another type of treatment. And outside of that, there are a lot of other newer modern therapies that people are getting now. So there's antibody therapy. There's something called immunotherapy. And there's also some other fancy words like proteasome inhibitors. These are all big kind of terms for some very, very specific type of medications that can treat multiple myeloma, but actually they help not affect your healthy cells. And that's the goal when we treat these cancers, is to try to just target the myeloma cell and not hurt the rest of your body and not hurt the rest of your cells. And that's why research is so important, because that is actually what, myself and some other people at Janssen are working on, trying to find therapies that do these things. So, to end my part, multiple myeloma is just something I think you want to know about. If you hear it, you kind of know what to ask for. And of course, the therapies that I listed aren't all the things, but if anyone tells you this may be the case for you, make sure that you don't be afraid to ask questions. Don't be afraid to ask about any type of research that's available, and you're going to hear a little bit more about that from the other panelists. And just don't be afraid to have a very open conversation with your doctor about what you're feeling and kind of what you think should be the next step for you. So thank you.
Thank you so much, Robin. Knowledge is power, and it's important to know about these diseases. When we hear the words multiple myeloma, you can leave today with a little bit more information. Next, Jennifer is going to share with us some of the disparities. She's going to dig into a little bit more detail about the differences that we see in this disease area across race and ethnicity, et cetera. Jennifer,
Thank you, Lisa.
you're welcome.
All right, so as previously mentioned, and we know that multiple myeloma as a whole is not the most common cancer. However, it does disproportionately affect our African American or Black communities as a whole. In fact, our Black patients tend to be 2 times more likely to die from this disease when compared to other groups. And so when we stop and think about our ancestry, our background, we know that these are things that influence our genes that we pass down from generation to generation. And so we do have some data to suggest that Black patients that are affected by multiple myeloma tend to have some differences in that myeloma cancer gene, in that it could potentially be associated with a less aggressive form of the disease. And so therefore, if caught early, intervened on early, and treated early, this could potentially lead to better outcomes in the future. However, despite this, we do see that Black patients affected by myeloma in our community have the highest mortality rates. And so taking that information into consideration, we try to think about why this might be happening. And so we try to see if potentially a lack of access to care could be affecting this as a whole.
Thank you, Jennifer. And very important points. And can you tie that into why access to research studies are so important, specifically for multiple myeloma?
That's a great question. I think clinical trials in general across all disease states, especially within myeloma, is key and very important. Whenever possible, if a patient is eligible and willing, clinical trials should be discussed, and they should be continuously discussed with patients and providers and provided opportunities. And so despite this and despite the high prevalence that we do see of myeloma within our Black communities, when we take a step back and we look at the clinical trials that are out there within myeloma, we are noticing that Black patients only account for less than 5% in enrollment in these clinical studies. The same thing also holds true with regards to low enrollment rates and those of Hispanic and Latino descent. And so the biggest factor or the biggest point that I want to make is the huge reason behind why clinical trials are so important and why it's important to have diverse patient populations included in clinical trials is, for example, we're able to gather more data on some of these genetic differences, for example, that I previously mentioned, as well as we can see how drugs work between different groups of patients.
Thank you so much, Jennifer. So now that we've gotten a little bit of an introduction to multiple myeloma, the disparities and differences that exist, and the importance of research for this particular disease, I want to pass the baton over to Stacey Hargraves, who's going to share with us the bigger picture, why diversity is important in how we conduct research, not only in multiple myeloma, but across multiple disease areas. So Stacey, can you kick it off for us? Why is it important for us to have diversity in clinical trials?
Thank you so much, Lisa, and good afternoon, everyone. So let's just talk about why. So we know, and as you've heard up during the day, that many diseases, such as cardiovascular disease, cancer, we heard about multiple myeloma, disproportionately affect people of color. And we also know that it's also certain people react differently, right, to the diseases based on age, race, ethnic background. So it's important that we understand those factors, and those factors come about because of research. And I say this because it's very important that we understand that as we mature through the drug development cycle, there's certain things that we do in terms of testing and research and understanding the diseases that allow us to make statements like multiple myeloma disproportionately affect people of color. And that's because we have all the research in-house and be able to talk about and do the extraction of the data and talk to physicians to be able to communicate this, and this is how the information flows through. The next slide that you'll see just talks about what we know. And in that fact, if you look all the way to the right, waiting for Lisa. There we go. All the way to the right, you see that we as people, Black and African Americans, make up 13% according to the latest US Census. However, only 8% of us, if you think about all the disease areas and states that we have, participate in clinical research. And that's a very important distinction between us and some of our white counterparts, and that they're participating in the research, so we know a lot more about disease states for certain types of populations. I've made it my life's work to change this. I want to make sure that we are participating in clinical research so that we know about chronic diseases that are affecting us today. And not just the chronic diseases that affect us today, I'm talking about the things that we know in terms of genetic makeup. There's a lot of things in advances of medicine, and sometimes we're being left behind because we don't understand or know how some of these diseases are affecting our family members, affecting you individually, or affecting our aunts, our uncles, our grandmothers. So it's important that we participate in clinical research. The other thing I want to point out is many people, the other thing I want to point out is that many people believe that people of color don't want to participate in clinical research. So therefore, we don't design studies for people of color. And that's not true. I found in multiple instances that we don't participate in clinical research because we don't know. It's an access issue. Right? Oftentimes, the other reason why we don't participate in clinical research and clinical trials is because the physician that we're seeing isn't, thank you for that, the physician that you're being treated by isn't aware of clinical trials either. So therefore, how can they know about something they don't necessarily know? I would be remiss, though, if I sit here and say just participate without acknowledging the history. There's a very storied history, right, in our community in terms of clinical trials. We can talk about Tuskegee, we can talk about Henry Lax. There's a number of examples. But I want to tell you that there are now safeguards in place today that weren't then to protect us from some of those things that have happened in the past. So therefore, it's important to acknowledge the history. It's important to acknowledge the resulting things that happened because of that history, and that should not be a reason why you don't seek information. You can always decline to participate in a clinical trial, but you can't participate in something that's not offered or that you don't necessarily understand. So the last thing I want to leave you is, I talked about a little bit earlier about why, right? The benefits of doing it. One, there are new findings and differences in diseases, right? Research is happening all through multiple companies. We have the director of the CDC here today. Research is happening for chronic diseases, new medicines and modalities that we're finding. And it's important that we understand, right, how that research can be applied to people of color. So that's the main thing. The other thing I want to make sure is that all of us are empowered with information about clinical trials. You don't have to participate, you don't have to say yes. But if each of you take it upon yourself to educate around the clinical trial process and the details of it, phase 1 studies, what does that mean? Healthy volunteers, phase 4 studies, post-approval studies. All of this seems like very technical. But there are different phases of clinical research that you can volunteer for. And that will make you, depending on where you are in your tolerance, comfortable or not comfortable. But the fact that you can have that conversation with your family members is important because it becomes a care option. And we are wanting to make sure that clinical trials is a care option for everyone, regardless of whether you take it or not. So the last thing I'll leave you with is what we've called Research Includes Me. If you visited our table, if you talked to any of us from Janssen, researchincludesme.com. It's agnostic of any product, any company. It's here to educate all of us about clinical research. What does it mean to participate? I encourage all of you to go on there, to look at it, to educate yourself about the clinical trial process, to decide if clinical trials is for you or for a family member. And if you do that, I am confident that the future of medicine for people who look like us will improve in the future.
Thank you so much to you, Stacy, Jennifer, Robin.
Walk away today informed. Knowledge is power. And there's a saying that I've heard, this is my personal thought, nothing about us without us, right? So as Stacy just tied it together, it's important to make sure that we're included, whatever the disease area is, so that, we can feel better about, treatments that come out in the future. Please scan the QR code up on the screen if you didn't, or stop by our table. You scan that QR code, it will take you right to researchincludesme.com to, again, as Stacy said, just learn about clinical research in general. And then also, if I can click one more forward, try again. There we go. That's mywordmm.com. At Janssen, we take this very seriously. We want folks to know about multiple myeloma. If you visit this website, you can learn even more information about resources, types of treatment, what the disease really means for people's lives and caregivers and your families. There's an online community, a Facebook community, so please visit that'smywordmm.com and visit our table. We also have information about that as well. I want to take this opportunity to thank my co-panelists today, my colleagues. I also want to quickly thank the Janssen Oncology Diversity, Equity, and Inclusion in Clinical Trials team, the Janssen Oncology Diversity, Equity, and Inclusion Council. We have one of the co-leads here today, Eunice Artis. I want to shout her out as well and her part in this. She's in the corner over there. And again, please visit that'smywordmm.com, researchincludesme.com. Thank you for joining us today. It's been a pleasure being with you. Visit us in the back.